Good evening and welcome to the latest Portland Clinic live chat here on Facebook Live. I am Colby Reed and I'm joined by Dr. Pamela Scherer for Keeping Your Rose City Glow. Today our subject, of course, is dermatology and skincare. Dr. Scherer, thanks so much for joining us.
Thanks for having me.
Now, Dr. Scherer, let's say I were to pull the dictionary off of my shelf and I flip to the definition of good skin. What's that going to look like?
So in general, healthy skin has a few components. One is that there's no skin cancer, there's no precancer, and then in general we think of healthy skin as also being disease-free, possibly wrinkle-free. However, it's really an individual concept because although the issue with not having skin cancer and not having precancer applies to everyone, for some people being disease-free is really not necessary. For instance, one disease you see on the skin is acne, and for some people they might not care if they have acne, and if you don't care if you have acne, it's okay to have a little bit of acne. You don't want to have severe acne that's causing scarring and disfigurement, but it's really an individual definition on that front.
Okay. Now I want to talk a little bit more about acne in depth because it's such a common problem, but at a high level, what are the most common skin issues that you tend to see at the Portland Clinic?
I would say the most common things we see are, one, people coming in for various growths on their skin, whether that's things like warts or other growths that they're not sure why they're there, or various moles or sunspots, red spots, things that they're concerned are skin cancers. We also see a lot of acne, like you said. Various rashes are really common, things like eczema, psoriasis. We get people coming in with more cosmetic concerns or just concerns about things they want removed from their skin. I'd say those are the most common things that we see.
That's quite a list and quite a variety of issues. What sorts of services can the dermatologists at the Portland Clinic offer to patients?
So at the Portland Clinic, we have 4 different dermatologists in multiple locations where we see patients, and all of us really treat any condition that you can get of your skin, also your hair and your nails. Not everyone's aware that dermatologists deal with nails and hair. And then we also do some cosmetic treatments, and those include treating wrinkles and treating age spots, treating various red spots. We even have several lasers at our Beaverton location where you can get treatment of leg veins and treatment of brown spots, red spots, all of that.
Lasers?
Kind of yeah.
Impressive. Now, if I've never been to a dermatologist before, what am I going to expect on my first visit? Are you actually going to start breaking out the lasers on me right away, or is that kind of a second or third visit option?
So it really depends on what you're there for. So a lot of times, say you're coming in just for a general skin check, you want to get your moles looked at. So what would happen is you come into the office and you're brought back into the room by a medical assistant. They find out why you're there. Do you have any specific things that you're concerned about? And then, what's your general history? And then they'll have you take off your clothes and put on a gown, and then the doctor will come in and they'll take a look at your skin, ask you more questions, and depending on what they find, you may just get a prescription, you may just get some advice, or in some cases you'll have a biopsy done of your skin, you'll have an injection. Usually lasers aren't the same day, but there are rare cases when you might get a laser that day. So yeah, it really depends on what you're coming in for, but then at the end, of course, all your questions will be answered and further recommendations will be given.
Excellent to know. We do want to let our listeners or our viewers at home know if you have questions of your own, please feel free to submit those with the hashtag AskPortlandClinic. Now we've been talking a little bit about some of the issues that can come up with the skin and some of the common problems, but preventative care can be a great way to make sure that those don't necessarily rear their ugly head. So for a daily regimen, what are some good tips for keeping your skin healthy?
So on a daily basis, one thing you want to be doing is just washing your skin. Now the frequency with which you need to do that varies depending on what skin type you have. But for the average person, once to twice a day, washing your skin, and then applying a lotion if your skin is at all dry to keep your skin moisturized are important. And applying a daily sunscreen is one of the most important things you can do preventatively as part of your skincare routine. And that's not just when it's sunny out, but doing it every single day.
And you mentioned that has to do depending on your skin type. I'm assuming that that's something, your personalized skincare regimen, you can talk to your doctor about that and they can help you determine what is best for your skin type.
Exactly, because some people will have more oily skin, and for those people they might need to wash more frequently. Some people are more dry, where if they wash too frequently it'll actually cause rashes on their skin like eczema and other problems. So yeah, it's a very individualized thing.
Outside of our, our daily regiment and our proactive steps to keep our skin healthy, what are some other things that maybe could have an impact on our skin's appearance? Things like our diet, our exercise, our sleep. Can those influence our skin as well?
So that's a great question, and it comes up all the time in the office because I think in general, and also especially in the Pacific Northwest, people are interested in natural things and in prevention, and so definitely diet can have an impact on your skin. So that comes in a couple of different ways. I think the most common thing we can actually help with diet is acne, and there's been a lot of research out there on how acne is affected by diet, and the thing that has come across recently is that you have to pay attention to the glycemic index in your diet, and that foods, if you eat a diet with a high glycemic index, it actually makes acne worse. And I'm definitely not a nutritionist, but things that are high glycemic index tend to be things that are low fiber and high sugar, so things like white rice, white bread, sugary foods that can make your acne flare. In terms of stress, that's a big one. It definitely makes various skin diseases flare, things like acne, eczema, psoriasis, all these different skin conditions flare with stress. And interestingly, there have actually even been studies looking at people who have a lot of stress. There have actually been more animal studies, but it's shown that stress can actually make your skin age faster, which we don't know exactly why, but it's been shown. And then exercise definitely helps to keep your body at an appropriate weight, which if you're at an appropriate weight, that really helps various skin diseases. There are certain diseases that are worsened by obesity and various rashes you get when you're overweight. And then exercise too can help with, for some reason, aging of the skin, and we don't understand exactly why.
You touched on acne again in that response, and so I want to talk about that because that's one of the issues that a lot of people are going to deal with throughout their lifetime, whether they're a teenager or an adult. What causes acne? Where does it come from?
So there are three big things that cause acne. One is excess oil production of the skin. Another is plugging of the follicles on your skin. And then the third one is bacteria on the skin. Certain types of bacteria do play a big role in acne as well.
Okay. Now, when I was a teenager, I had the odd pimple here and there, but I'm in my 30s now, and I can't help but look in the mirror, and occasionally I see a pimple pop up here and there, and I'm curious if acne in adults is that common, or is that a rarity?
So that's a great question, and another thing that comes up all the time. So the short answer is it's normal to get adult acne. It's normal to get acne at any point in your life, and I see people all the time coming into my office of every age and saying, I have acne, why is this happening when I'm 20, why when I'm 30, 40, 50, and it does happen. We do see different types of acne at different ages in life. One of the really common types of acne we see that's very frustrating for people is called adult female acne, and it's a very hormonal type of acne that tends to occur cyclically, sometimes with the menstrual period. It tends to be along the jawline, and they get these big cysts, and it can be very frustrating for women and hard to treat.
Okay. What can I do to prevent acne if I find I'm getting it at age 20, age 30, age 40?
So a lot of the things you can do for acne are part of that daily skincare routine that we touched on. So acne patients in general tend to be more on the oily side for their skin, so making sure you're washing your face usually 2 times a day. Sometimes once a day is okay, and then every time you sweat you'll want to clean your skin. You may even need to use special face washes that are for acne, and those will often contain things like salicylic acid or benzoyl peroxide, and those compounds can help with the acne.
Okay. Now, want to dive a little bit more into the potential remedies for acne. We see a lot of commercials, obviously, for different acne products, particularly targeted at young adults. But what are the over-the-counter prescriptions that are out there that you would recommend, or that are kind of the best first place for people to start if they are dealing with acne?
So the best things to start with would probably be the acne face washes, which we were touching on. So the most gentle one out there is salicylic acid, and that's the most common one that you'll see in the face washes. So pick up almost any face wash from the acne aisle and it'll be salicylic acid. The next line up would be a benzoyl peroxide product. Those ones tend to be a little more irritating, but in a lot of patients they're more effective. And then there are also some gels out there containing benzoyl peroxide that are over the counter, and those can be used for spot treatments. They help to kind of dry up acne, but if you put them all over your face, for most people it's going to be too irritating for the skin.
Now, am I correct that benzoyl peroxide, am I thinking of the correct one, that benzoyl peroxide can also have a staining effect? So if you're using it with linens, it can ruin your laundry?
Yes, so benzoyl peroxide, yeah, it does tend to bleach clothing, so you have to be careful with that. The face wash, not as much if you wash it off afterwards, but definitely with the gels, if you're putting it on your face, you'll notice your colors might get stained white, and yeah, you definitely have to be careful with that one.
Okay. Anything, if I'm looking at maybe an over-the-counter acne treatment, anything I should look to avoid? Something, we sometimes hear that maybe too much alcohol in a product can be drying to the skin. Is there something like that we should watch for to avoid?
There aren't any specific ingredients I would say that universally should be avoided. It's just important to really pay attention to how your skin reacts to a particular product and to know your particular skin type, because there are a lot of people who can't tolerate various different acne treatments, so just trying something maybe on a small area of your skin first if you have sensitive skin and making sure you tolerate it well is a good idea, but it's not like universally this one ingredient is bad for people in general.
Okay. So it's the time of year when we're saying farewell to summer and we're moving into fall and we're moving into that colder seasons, and it seems like when the weather turns cold, skin starts to dry out, it gets itchy. What are some ways or things that we should be watching for in terms of dry skin when we move into fall and winter time?
So dry skin in the winter and all year round tends to be a big issue for people, and it can make people really prone to getting different types of rashes, because when your skin dries out, it really breaks down the skin barrier and makes the skin, just that much more prone to having problems. So things you can do to help that are mostly revolve around applying moisturizers to your skin, and it's a really good idea if you have any issues at all with dry skin to use a daily moisturizer, and that can be, there are a lot of different types of moisturizers you can use. The most gentle type of moisturizer would be putting on a lotion, and lotions are nice because they're lightweight, you can put them on during the daytime, they soak into your skin easily, they're pretty cosmetically elegant. The next step up would be to actually put a cream on your skin. Creams are thicker and they usually come in jars. They do a better job of moisturizing than lotions, but they take a longer time to kind of soak into the skin, and so those oftentimes you'll want to apply at night before bed. And then the third step up you can take is actually to put an ointment on your skin, so that would be something clear and greasy like Vaseline or Aquaphor. Those are really strong and they do really moisturize the skin, but they take a really long time to absorb, and they're also very greasy, so some people hate them. So that's important. Minimizing the amount of soap and water on your skin is going to help as well. So you obviously have to keep yourself clean, but if you wash yourself all day long with soap and water, every time it's going to dry out your skin, worse, so you want to be careful with that.
Excellent, excellent. Now we are doing a live chat today, which is great because it gives us the opportunity to take questions from you, the audience. If you have questions, please feel free to submit them with the hashtag AskPortlandClinic. We're going to take a question from Casey A. Casey A asks about exfoliation, and the question is, does exfoliation help clear the skin? And if so, how often should I exfoliate?
So that's a really good question. Exfoliation, it's tricky because it can help certain things, but it can also make other things worse. So in general, exfoliation is the process of removing the kind of outermost layer of skin cells from your skin, and that can be done either mechanically with a brush, or there are certain chemicals that you can put on your skin to help exfoliate the dead skin cells. And for things like, for certain types of acne, it can be helpful, but the problem is that it can also really irritate the skin, and so if you use it when you don't have the right skin type or the right acne type, it can make things worse, and it can actually cause dark spots and other issues on your skin. It can also be helpful for some people for when they have sun damage on their skin to kind of exfoliate, but again, it's helpful only in the right setting, so you really have to know your skin type and be careful with it. So it's definitely not something I'd recommend just for the average person walking around on the street, but in certain people it can be helpful.
Is there a difference using exfoliation on your face versus, say, your chest or your arms or your legs, or is it pretty much universal, the same policies apply?
So it's pretty similar. Similar things can be said about exfoliating anywhere on your body. I'd say we're most careful with the face because that tends to be more gentle skin. And sometimes we do recommend exfoliating on the body for conditions that we wouldn't recommend it for on the face. But you can still see the same issues on the rest of the body that you can see on the face with it.
Excellent. We want to thank everyone for tuning in this evening to our live chat here with the Portland Clinic on Keeping Your Rose City Glow. If you're just joining us, we're talking about all things dermatology and skincare with our special guest, Dr. Pamela Scherer, one of the dermatologists at the Portland Clinic. If you have a question, we'd love to hear from you using the hashtag #PortlandClinic. I'm Colby Reed, your host, and we've talked a little bit about dry and seasonal skin. Now I want to move into a little bit more serious subject. I want to talk a little bit about skin cancer. What are the risk factors involved for getting skin cancer?
So there are several different risk factors for getting skin cancer. Some of those are things you can easily see, such as your skin color. People with lighter skin are higher risk for skin color or for skin cancer. Eye color is also a risk factor, so blue eyes, green eyes, you tend to be higher risk than people with brown eyes. So those are the easily visible things. Other things, if you've had a history of any radiation therapy to your skin, that increases your risk of skin cancer. If you're taking medications that suppress your immune system, that increases your risk. If you've had skin cancer in the past, you're at increased risk for skin cancer. People with lots of moles, usually if you have greater than 50 moles, that's the threshold we'll use, is indicating that you're increased risk. And then if you've had a family history of skin cancer, or if you've had a personal history of skin cancer. And then there are environmental exposures as well. If you've had a lot of sun in the past, if you've used tanning booths in the past, certainly you're at increased risk.
Excellent. We actually have a question from our audience coming in on this subject from Annie F. Annie asks if there are more risks involved for certain types of skin cancer here in the Northwest. Are we at a higher risk for a specific type of skin cancer here in the Pacific Northwest?
And we actually are. Interestingly, we're one of the top states in the country for melanoma. We're
Really?
actually number 5, out of all 50 states for melanoma.
Is there a particular reason for that? Do they know, or?
It's not really known. Number 1 in the country is Delaware. Number 2 is Vermont. Number 3 is New Hampshire. We're number 5, and then number 8 is Washington. So, those are not the states you would typically think of when you think of skin cancer. It's not Florida, it's not Texas, it's not the states that have the most sun. And what's thought is it might be related to us getting more intermittent sun exposure. We're in the Pacific Northwest, we definitely like to be outdoors a lot. And because we're not out there every day, we might not be wearing sunscreen every time we go out. There's some thought that it might be related to more just having a lot of Caucasian people in our state, but Delaware has fewer Caucasians than Oregon, so that wouldn't really, explain that. So the main summary is yes, we're definitely at increased risk for melanoma here in Oregon, so you have to be careful of that, and we don't understand exactly why.
So how do I go about doing a skin check to see if I am showing signs of skin cancer, if I need to seek treatment?
So definitely very important to examine your own skin and to know what your skin looks like and what type of growths you have on your skin. So things to watch out for. When you're looking at moles, which are the brown spots on your skin, you're looking for several things. We call them the A, B, C, D, E rules. So A is asymmetry. You don't want your moles to be asymmetric, where you see, something different on one side than the other. B is for borders. We like borders of moles to be nice and round. We don't like them to have notches or to be kind of blurry borders. C is color. Ideally, a mole should be one color, and we like to see them as like a light brown or maybe a dark brown. We definitely don't like to see multiple colors, especially if there are 3 or more colors, and we don't like blacks or blues or reds in moles. D is diameter, so any mole bigger than about a pencil eraser diameter should not be a new mole. It should be one that you've had, pretty much since you were young. And then E is probably the most important thing when you're looking at your skin. That's evolution, so any mole that's changing, you really want to keep a close eye on that. For other types of skin cancer that we see, things like a basal cell or a squamous cell skin cancer, which are also very common, you're looking for more pink spots. They might be sores that aren't healing, or crusty spots, or sometimes they can actually be really subtle.
So we've talked about, we've talked about the risk factors, and we've talked about detection, but what about prevention? What are the steps that I can do to prevent skin cancer?
So by far the most important thing you can do to prevent skin cancer is to protect yourself from the sun. And that doesn't just involve sunscreen. Other things that are really important to plan your outdoor activities to not be between 10 a.m. and 2 p.m., which are kind of the peak sun hours. And then, of course, wearing sunscreen when you do go out every day before you go outside. Putting on your sunscreen is really important. And then avoiding tanning salons, that kind of thing.
Jumping in on the sunscreen issue, my wife and I debate this every summer. I like to get the SPF 50. I don't want any tan at all. She wants the SPF 4, and we go back and forth. But what kinds of sunscreen should I really be looking at to protect myself? Is there a difference between, for example, one to protect against UVA and UVB rays, or the SPF number? What should I be looking for?
So you want an SPF with a minimum of a 30, as for pretty much everybody. Mm-hmm. And then you want it to say broad spectrum. Broad spectrum means that it covers UVA and UVB, so that's very important. You want to get protection against both. So if you've hit SPF 30 and broad spectrum, you probably have an okay sunscreen. And then water resistant is also a good quality to have in a sunscreen.
Same rules apply if we're talking about kids?
Same rules apply with kids. Now with kids, you may want to use sunscreens that are specifically meant for kids, because sometimes those tend to have ingredients that are more good for sensitive skin, because kids tend to have more sensitive skin that's more easily irritated.
Okay. Now, another question that has come up is sunscreen is great for preventing sunburns and whatnot, but is it also going to prevent me from the good side effects of getting sun, for example, vitamin D?
So another question that commonly comes up, and the main answer to that is yes, being in the sun does increase your vitamin D. However, it's not a safe way to get vitamin D, because the sun is a known carcinogen, which means that it causes cancer. So it's a much safer thing to do to just take a supplement that has vitamin D, or to eat foods that are rich in vitamin D, rather than to sit out in the sun. For instance, if you compare it to cigarettes, if cigarette smoking raised your vitamin D, and you said, hey, should I smoke a cigarette so I can get vitamin D? We would say no, eat a food with vitamin D, take a supplement, don't expose yourself to something that can cause cancer to increase your vitamin D.
We're coming to the end of our conversation, but want to kind of take another 30,000 foot level and look at how important is skincare when we're talking about overall wellness. When we look at the overall wellness of a person, how does skincare fit in there?
So skincare is incredibly important for your overall wellness. Your skin is your most visible organ. It's what everybody sees when they look at you, and if your skin's not healthy, then it really can cause a lot of issues for your self-esteem. It can cause a lot of stress. It can really be a very traumatic thing for people when they have skin disease. And beyond that, your skin is also the thing that protects you from getting from outside exposures causing diseases to your internal organs. So the skin is very important to keep healthy.
Excellent information, Dr. Scherer. Thank you so much for taking some time with us this evening.
Well, thank you for having me. It was a pleasure.
And thank you for tuning in this evening to our latest live chat on keeping your Rose City glow with the Portland Clinic at #AskPortlandClinic hashtag. If you are interested in future chats, make sure to follow the Portland Clinic on Facebook. Also follow us on Twitter. And for the Portland Clinic, I'm Colby Reed. Thanks for tuning in.